Hi, everyone. Welcome. I'm so glad you were able to join me tonight. Just waiting for some more people to show. Welcome. So I guess I'll get started. My name is Farhy. I'm a licensed clinical professional counselor and trained and certified in DBT. I absolutely love what I do, and I work in private practice now, and I do it virtually. Most of my clients are from all different populations, all different diagnoses, and I love spreading awareness for DBT. It is for sure my passion, and I do it a lot, and I very much advocate for DBT across the spectrum. So although DBT, a little bit of background. So although DBT was originally created for borderline personality disorder from Marshall Linehan, it is very much relevant to everyday life and everyone who not even like struggles, but really just everyone who wants to gain more control over their emotions. And so it's very relevant just across the board. So I love spreading awareness and I love talking about it. So I'm really excited about tonight. So my goal is for you to just get a little bit of a taste of what DBT is, a little bit of a taste of the skills, just so that you're, again, like more aware, and hopefully you can even take some of these skills with you and like practice them in your everyday life. That's the end goal. All right. So the biggest question that I get a lot of times, like at the beginning of therapy, is, especially when they start with DBT, is the biggest question is, what is dialectical, right? So DBT is dialectical behavior therapy. So what is DBT? What is dialectical? So it's the idea that two seemingly opposite things can exist at the same time, right? So the idea is that, especially for DBT, it's the idea that two things that are seemingly opposite, like for DBT, it's acceptance and change, right? So it's the idea that although DBT is originally created for changing behaviors, right? It's a behavior therapy that is pushing for change in ineffective behaviors. The idea is that even though we're pushing for change in behaviors, and it runs the gamut, right? So originally it was created for self-harm and suicide ideation and really extreme behaviors. The idea is that we always want to change certain behaviors that are just not working for our lives anymore, right? So whether it's lashing out or whether it's relational things that you get into with your spouse or friends or whatever, angry outbursts, shutting down, right? So any sort of behavior that's just not working for you, DBT is pushing for. At the same time, we believe as DBT therapists, and according to this theory, that we must always accept ourselves, right? So even though we're pushing for change, it's the idea that we also really accept ourselves and we almost like lovingly embrace ourselves. So what we say as DBT therapists is, even though you're pushing for change, we always need to kind of lean on the other end of acceptance at the same time. So as a DBT therapist, it's my role, and it's something that I encourage everyone and you as well to push yourself, but also know when to hold back and know when to validate, know when to accept, and know when to just kind of like just chill out and just accept yourself, accept the core self. So sometimes people come into DBT with the idea of like, I hate myself and I need to change all these behaviors. I lash out at everyone. I do things that, are not effective in my life. And therefore I am XYZ, and they kind of like fill in the blank with all these derogatory statements about themselves. So as a DBT therapist, it's really important to say, no, you want to change these behaviors, but you're a great person and your core is good and you are deeply good inside. So there's something that I kind of wanted to quote. I'm not sure if any of you have heard of Dr. Becky Kennedy, who's such a role model. And she is a licensed psychologist who advocates for parenting in a really incredible way. And she has her own line of kind of parenting or parenting method. And she put out a book called Good Inside. And I'm a big advocate for it. I think it's fantastic. And she writes in her book, and she didn't even mean to kind of touch on this dialectic, I think. It wasn't even in regard to DBT. but it's a really great quote, and I thought that I just kind of bring it up in relation to this. So she says, we do better as individuals when we approach our own internal monologue with a two things are true perspective. Multiplicity is what allows a person to recognize that I can love my kids and crave alone time. I can be grateful to have a roof over my head and feel jealous of others who have more luxuries. So it's the same idea that we can have both existing at the same time, and it doesn't make us bad for engaging maybe a more negative, again, like behavior or approach. It just means that we have two things going on at the same time. And I really like the way she writes that. Like that, this is the way that we need to live, right? That like we all live with multiplicities. We all live with this idea that, yes, we need alone time. We need time to rejuvenate. We crave that time, maybe away from everyone, away from our families. It does not mean that we do not love our families, right? It means that we love our families and we also need time to rejuvenate. So it's just kind of advocating for this like middle ground that's so important in DBT and just like in general. So that's this dialectical piece, right? And this is a fundamental that we need to kind of accept as we move forward, right? That both exist at the same time, acceptance and change. Now, all the modules and all the skills in DBT falls into one of the two categories. So you will always find that, I don't even know how many skills, I think there's about like 22 skills, 21 skills in total. There are 4 modules, and each module has 4 weeks in it. So there are 16 weeks in general in like the group. But in terms of skills, it's about 21 skills. So in all these skills, it falls into one of those two categories, acceptance and change. So you can always just try to figure it out, or it will be indicated somewhere. But the idea that, yes, we're either in this acceptance place or we're in this change place. So today I kind of wanted to just bring up a few skills that I find particularly relevant and are really widely used, really helpful. And I feel like even just getting a brief exposure tonight, if this is your first exposure to DBT, this could be really helpful for you just moving forward. The first one is mindfulness. So DBT is rooted in mindfulness. The reason for this, and many people have obviously heard of mindfulness, it's a big word in society, right? People talk about mindfulness and all different therapies. But in regard to DBT, it's the foundation, because what we say is in order to push for any change, we need to know. We need to know ourselves. We need to know what our thoughts are. We need to know what our emotions are. We essentially need to live with this awareness of who we are, what we think, how we feel. Once we know that, then we can move forward to change, right? Then we can push forward in all different regards to, right, like all those different change elements. And we have plenty of change elements and change skills as in part of DBT. But the first step is always to know yourself. When I have run groups in the past, I've run some DBT groups in previous years. And what we do is the first group out of the 4 of every module, so the first of the 4 weeks of every module, we go over mindfulness. So we have like a mindfulness review. And the reason for that, and a lot of the members kind of like don't like that because it's kind of like reiterating it, and they kind of always ask like, why are we doing this again? And I always say is, this is the foundation. Like you need to know yourself, you need to be skilled, and we need to train you to really know what is happening internally before we move forward. So with that being said, the definition officially is intentionally living with awareness in the present moment, not judging, not attaching. So I'd like to give the analogy for mindfulness of, I want you to picture right now a tank, right? And there are little fish swimming by, and you're just viewing the tank and you're viewing the fish swimming by. Now, you can choose to attach to a fish or choose to not attach to a fish. So the idea with mindfulness is picture yourself with a tank, right? Picture yourself internally. Your thoughts are like a tank. And each thought is like a little fish swimming by. And you are aware of the thoughts that are kind of coming and going, but you don't have to attach to them, right? It's the idea that you can choose which thoughts and which emotions you'd like to hook onto. So for example, let's just say you choose, and I'll talk about this in a minute, but like having a mindfulness activity, a mindfulness, you decide to do like a mindfulness, whatever, for 5 minutes. So you set your timer for 5 minutes and you sit there, right? And let's just say you're doing a mindfulness of current thought, like activity, which is what you would do. You would kind of sit there and you'd observe your thoughts. Challenging to do, but people try to do that, and you can do that. In groups, we do that. So essentially what you're doing is you're picturing your thoughts like a tank, and you're sitting there, you're almost like watching your thoughts pass by, right? So you're watching, you have a fish pass by that says, I didn't like today. Today was not a good day. And then you have another thought that says, I'm so worried about tomorrow. And then you have another thought that says, oh my gosh, the way I came across the other day was just, ridiculous. Or then you have another thought like, oh, I'm really excited for this event that's happening. Again, you'll watch your thoughts. Now, again, this activity trains you to just observe, right? You're not judging them. You're not sitting there judging all those fish swimming by. You're not saying, oh my gosh, I'm such a worrywart. Oh my gosh, I am always telling myself negative thoughts. You're just like observing them, right? So that's the idea of mindfulness, right? Like you're just intentionally aware in any given moment, but you're not necessarily engaging with what you're aware of. You're just observing it. Now, what I like to encourage and what I encourage in the groups and as well as just individually is adopting a practice. So adopting a practice every single day. And this could be a practice that you already do, right? So if you already drink coffee, choose to drink your coffee mindfully. What that would look like would be, let's just say for the first 2 minutes, set your alarm for 2 minutes, no distractions, no media, no phone, no planner, nothing. You're not looking at anything. You're simply sitting there with your coffee. And this would be a sensory experience. So this is personally what I try to do. Just absorb how the coffee smells, how it tastes, how it's kind of going down your system, all the senses involved. Now, this sort of mindfulness is the awareness of how your body's feeling in this present moment, as opposed to how your thoughts were feeling in the other mindfulness that we described. So it's the idea of like living intentionally, living with awareness in any given moment. Again, whatever you choose to focus on. So for the coffee, you're choosing to focus on the coffee. Another example would be if you like to work out, right? If you like to run. So I encourage for the first 5 minutes of your run, don't put on any music, no media, nothing. Just observe how your body is feeling at that given moment, right? Like your muscles are feeling a release, you feel really great, or you can notice that your body's feeling really tired. But all it is just the awareness and the focus on that given moment, which is your body. Now, the end goal of mindfulness, and I really like to say this because a lot of people have this question of like, okay, I could do this little activity of the coffee, and that's cute and whatever. What's the goal here? The goal of mindfulness and the goal of these activities, although they're nice, the goal is control of your mind. It's control over your mind, that you are in control of where it goes at any given moment. Now, realistically, that's quite difficult to be in control of where your mind goes in any given moment. But it's the idea that you don't have to think of certain things, right? Our thoughts don't have to dictate us. Our thoughts don't have to drive us. We can choose where we want our minds to focus. We can choose where we want our emotions to go to. And it all starts with these activities. It all starts with these practices of gaining control. And in those moments, allowing intrusive fish to pass, right? We don't have to think of those things. We can return our attention back to the coffee, our body, etc. That's just like a brief little bit of mindfulness. Okay, the next skill that I want to talk about is within the module of distress tolerance. Now, distress tolerance, and I'm going to pause for a moment because I'm a very visual person, so I'm just going to draw this out because it could be really helpful. So I want you to think of your emotions on a Likert scale, right? So I'm going to draw it, let's just say 1 through 10. Okay, this is my little board. Okay. The 7 and 10 range, let's just say this is your range of emotion. Between the 7 and 10 range is when you're physiologically aroused, you can't think straight, and you can't problem solve. Let's just say someone broke really bad news to you, or you were just triggered multiple times throughout the day, and someone says something, and then bam, you're just aroused. You're at like a really heightened state, and you cannot think straight. So at this point, many times people will engage in an ineffective behavior, such as, in the most extreme sense, self-harm behavior, right? Like cutting. In a lesser extreme sense, it would be lashing out. It would be throwing something. It would be hitting someone. It would be running away, whatever it is. This is when you can't think straight and you do something irrational that maybe later you regret. At this point, between 7 and 10, is when you jump into distress tolerance. It's in those times where you need something to calm yourself physiologically in your body that signals to your mind that things are okay. And then you're able to problem solve. So what these things would be, and these are great takeaways, especially for you, any of you who are just getting their first exposure to DBT, This many times people will remember, and it will kind of like stick with them as like their first exposure to DBT, just because it's almost like simplistic in nature, but so wise. All right, so this is the acronym TIP, TIPP. So the TIP skills are really effective, again, between 7 and 10 when you're just calming your body physiologically. The first one is T, which is tip the temperature of your face. What this would be is get out a basin of cold water. So again, think of that moment when you're triggered, right? You're super triggered, you're at a 9, you're at a 10. You want to get your face into cold water, ice cold water, for about 30 seconds. It's a long time. And what this is going to do is calm your whole nervous system. It will just like bring you down. So again, ice cold water on your face, bam. And a minute later, you're already physiologically a bit calmer. More practically, people will say like, okay, I can't just like in the middle of a meeting, if someone says something that's triggering, my boss says something, I can't just like run and dip my face in cold water. So another idea is keeping water bottles in your freezer for moments like this, keeping oranges in your freezer for moments like this, and just whip one out, put it against your face, and it will just like calm you down. That's the first one. Okay, I is intense exercise. So what this is it's between like 2 and 5 minutes where you're getting your heart rate up really high, and then it will calm you down. So this would be going for a sprint around the block. Okay, you're supercharged, you're super triggered, go for a run around the block. Another one is jump into jumping jacks, right, in your living room. Just do jumping jacks. Go to your room, do jumping jacks really quickly. Another one is jump rope. Just something really intense that gets your heart rate up, like pounding. And then when you come down from that, you will be calmer, just automatically, without even trying. Okay, that's TI. P is paced breathing. So what this looks like is kind of like the classic deep breathing, but you want to do it paced. So it's in for 5 and out for 7. So in for 5 seconds, out for 7 seconds. When you breathe in for 5, your belly is expanding. And then when you breathe out, your stomach is contracting. So if you do that for if you do like 10 of those, that's already really effective in kind of bringing you down. That's really helpful. So just remember that, TIP. The second P is paired muscle relaxation. Paired muscle relaxation is when you are breathing, when you breathe in, you're tensing all of your muscles. So what's really effective is like you go down your body. So you start tensing your facial muscles, and then you tense your upper and then your lower, and you kind of go down your body and you tense each muscle group. And then when you breathe out, you release it, and you could tell yourself relax. So again, breathing in, tensing all your muscles, breathing out, saying relax. So it's kind of with that combination, you're again, like tightening your body, then releasing it, and tightening it and releasing it. And it will signal to your body and your whole physiological system to calm down. Those are the tip skills. Again, excellent takeaways. And I think that these could be really effective for you. In any super triggering moment, just remember these. Like keep a note card and just remember them. Okay, run and get my orange, or run around the block. Again, you'll be calmer. And just parenthetically, remembering that these are not the end-all be-all, right? Like if you do the tip skills, you're not good to go. You do the tip skills, then you're ready to problem solve. Then you're ready to sit down with your therapist. Then you're ready to go to your room and just try to brainstorm and figure out how to resolve the situation, right? This is just to get you to that place where you can think, if that makes sense. All right, so the next module is emotion regulation. Now, emotion regulation is that next step. Emotion regulation is when you're problem solving to like resolve any sort of emotion, extreme emotion that you're feeling and you don't know how to deal with. But it's more so like when you're thinking a bit more rationally. One of my favorites is, again, some of these DBT skills seem a little bit simplistic in nature, but so effective. So it's almost like don't judge until you try it. This one is opposite action. So opposite action is when essentially you're doing the opposite of the way you feel. So what that looks like is you're afraid of something, right? Like you're really afraid of, whether it's a person, whether it's a situation, you're feeling like that. So you go to your therapist and you're like, okay, I'm really nervous about this. I'm scared of this. What do you think she's going to say? Exposure, right? Try it. Do a little bit of it and see that it's not so scary, right? So it's the idea of like, let's just say, for example, a very relevant example is this IG live, right? I've never done one before. Super scary, super intimidating. I didn't really want to do it, but it's the idea of like, I'm a little bit scared, but I know I'll only get past that fear if I do it, right? So pushing past that initial fear is what will shift that emotion. And after I do it, hopefully I won't be scared anymore. I'll do more. But it's the idea of like, you move past your initial feeling, you push past that by doing it. Another one would be depression, right? So for sadness, many times people have the urge to just isolate, withdraw, not engage. How you get past that is through pushing yourself to engage, right? It's the idea that you do it. You are scared of going to this event. You're too depressed to go to the event, or you're too sad, you're too withdrawn. But no, you push yourself to go, and you end up feeling better. Most times you end up coming back from the event and you feel a little bit better, right? You may not feel like joyous, but you're maybe not as depressed as initially you were. So it's the idea of like pushing against what you naturally want to do. So that's just one of the skills, part of the emotion regulation module. Again, there's so many more, but this one is particularly relevant and helpful. The last one that I want to talk about tonight is in the interpersonal effectiveness module. So, interpersonal effectiveness module is when you are interacting with other people, you want to clarify your priorities. What are my priorities in this interaction? So there are 3 priorities that we like to talk about and we like to weigh out. So this is any interaction. Beforehand, again, if you're mindful, you're going to be thinking, what is my goal of this interaction, right? What is this goal? And there are 3 goals that we talk about. The first one is objective. The second one is relationship. And the third one is self-respect. And just because I like writing on the board. Okay, so the first one is objective, right? So this would be, for example, you are interacting with an Amazon customer service representative, right? And you need to get a refund. You want to get a refund for something that came damaged. So when you're interacting with this person, in your mind, I want you to think, what is my goal of this interaction? Is my goal to establish a relationship with this person? Is my goal to get something from this person? Is my goal to have some self-respect? Usually in that situation, your goal is to have an objective met. When you interact with this person, this Amazon representative, your goal is not going to be to be all mushy and to try and compliment the person and to try and make the person really like you. No, your goal is to kind of get that refund. So you will come across assertive, you will come across with like authority. And so that will reflect in your engagement with this person. Now, let's just say your goal is to have a relationship with a person, or to maintain a positive relationship with a person. So this would be like you're engaging with a spouse, you're engaging with a friend, someone who you want to have a close relationship with, you want your relationship to be positive. Your goal, because that's there, the way you interact with that person is going to be very different from the Amazon customer service representative, right? So when you speak with a friend, someone who you want to maintain, a parent, you may be willing to slide on the objective, right? Let's just say you're asking for something. You may be willing to slide on the objective if you know that that person who you're speaking to is not liking what you're saying or is getting offended. You may back off, right? As opposed to the Amazon representative, you may be more assertive and not really care as much in terms of like the way they feel about you. If your goal is the relationship, you will be very mindful of the way you're coming across in terms of like the way the person feels. That's your goal. The third example of what if your goal is self-respect? So a good example of this would be in a work setting, right? If a boss asks you to do something that goes against your values, right? They ask you whatever, a favor, they ask you something like that crosses over an internal boundary. That interaction with the boss is going to be, again, very different than if it was a spouse, if it was a representative. You are going to be very careful with your self-respect. Like you may even leave the job, right? You may pull out because this is that important to you. You're feeling about yourself. Like you couldn't live with yourself if you did this and your boss asked. So these things, again, back to the mindfulness, right? Like if we are aware of, okay, we're interacting with this person. what is my goal of this interaction? If you know beforehand, the way you come across is going to be so different. Many times this comes across sometimes when I see couples or a client is coming in and talking about a relationship and they're talking about like the way they're interacting with the person. It becomes very clear that in their mind, they are not being mindful of what's their goal, right? Like in their mind, let's just say it's a male who's coming to therapy and he's saying, like, I don't get it. Like her feelings towards me are different, whatever, etc. Kind of in that regard. And I'm kind of asking probing questions as to like their communication and what's going on. And it's very clear that he keeps pushing for objective. Like he keeps asking her to do things or things are very important to him in terms of like services in the house or things that he expects from her or, right? Like his objective is number one priority when in truth, it should be relationship, right? Like he should be saying things in a kinder way. He should be saying things in a more relational way that brings about those feelings of love and affection from her. But in his mind, he's thinking objective. Like he's thinking like, bam, like I need these things met. I need my lunch made or I need certain things in the house, but it doesn't really work so well as we women know. But so that's kind of the idea. We are wrapping up. I know it's really short. It went by really fast. But these are just some brief skills that I have found very helpful in my own life and that I really speak about a lot with my clients. And this is barely even scratching the surface of what DBT is. It is chock full of wisdom. I've been practicing it for years, clinically and just personally. And I'm just seeing that, again, across diagnoses, across populations, across the whole spectrum, they're so beneficial. And so, again, like although it was created for really intense emotional disorders, it's useful in everyday life for everyone. So I'm a big proponent of it, and I really hope to speak more about it in the near future. And I really hope all of you enjoyed, and hopefully can, gain something from these, skills. And yeah, I look forward to talking more about that in the future. And thank you so much all who joined and very much looking forward to continuing.